Hey. Okay, so guys, we went off and we've gone on again. We're trying to get Doc to join us. There we go. Doc is there. I see you, Doc. Please send me the request to join. Thanks for everyone that's come back now. We've got Family Matters, Dr. Q from Family Matters Fertility Center. Maybe I can send you a request to join. There we go. Got a request now. No. Dr. Okay, maybe Family Matters. So ask Dr. There we go. Dr. Q, are you there?
Yes. Am I supposed to change my screen? There we go.
That's it. There we go. How are you, Doc?
Finally. I'm good, thanks. And yourself, dear?
Good, thank you. Thank you for joining us. We're
Thanks
just
for the
having some
invite.
technical issues now. And you couldn't see me. You couldn't see I was live.
It wasn't showing that you're live. It actually
Okay.
just froze. Sorry about
Okay.
that.
No worries at all. Thank you for joining us. So we just we've got about 20 minutes to talk today. Sorry. I'm putting everyone in
No
timeline
problem.
today. So
No problem.
I don't know if you want to take a minute or two to just introduce yourself, tell us who you are. You're quite a favorite amongst the ladies. So I'm getting
Mm,
quite a few messages saying, I can't wait for Dr. Q's talk, Dr. Q. Just tell us
really?
exactly where you are as well, please.
Okay, so I'm Dr. Q. I'm an obstetrician and gynecologist. I'm also a fertility specialist. I'm based in Pretoria in Centurion. We run a fertility center called Family Matters Fertility Center. Show off the brand. So that's our center, yes. And our motto is making babies is our art. And art stands for assisted reproductive therapy. But in many ways, we assist people from the level of their problem towards achieving the goals of baby making.
Awesome. So we're going to get right to it. Our topic is ectopic pregnancy and can I conceive with one fallopian tube? First of all, what is an ectopic pregnancy?
Okay, so an ectopic pregnancy is a pregnancy that is implanted outside the womb, outside the lining of the womb. So it can be a pregnancy that is found mostly in the fallopian tubes. In the fallopian tubes, also, it's divided into different areas. We can say it's a cornwall if it's found within the shoulders, where the fallopian tube actually begins, or the middle of the fallopian tube, or the ampulla, which is more like the middle of the fallopian tube, or towards the end, and the fimbria, the fingers of the fallopian tube. So the ones at the fimbria, they are easily, nicely squeezable. That's why it's important as to where exactly is the ectopic pregnancy situated. So any pregnancy that is outside the womb, even at the level of the cervix, it could also be an abdominal pregnancy where the pregnancy is expelled by the tube and it grows outside the womb.
Wow.
So if the
Okay.
womb is affected, that's where the problem lies when it comes to fertility.
Okay. Then what causes an ectopic pregnancy?
So there are many causes of an ectopic pregnancy, and it's things that most women are not aware of. And we can start with simple things like lifestyle issues, things like smoking cigarettes that can affect the inside of the fallopian tube. The fallopian tube has got small linings, which we call cilia. They are hairs. I usually make an example to my patients and say it's like the hair we see inside the nose that we don't want. So the fallopian tube has its own hair as well that helps to push the tube, actually starting with the sperm, it pushes the sperm towards the egg and where the egg is waiting towards the end of the fallopian tube. And then when fertilization takes place, the same cilia, which is the hair, it pushes the baby towards and directs the baby towards the womb now for implantation. So those cilia are very important, and once damaged, it becomes difficult for fertilization to take place, and it becomes difficult for the movement of the embryo to find its direction into the womb. So that's why it's the damage to the fallopian tube is actually important, and this can be caused by even cigarette smoking. It also can affect the blood supply to the tube. It can damage the cilia that is so vital to the tube and towards pregnancy. What we commonly see, especially in underdeveloped countries, is sexually transmitted diseases or pelvic inflammatory diseases. So these are diseases that start at the area of the vagina during sexual intercourse. A woman most times is not aware, or she'll wake up with a rash, or maybe she'll have a small sore or a pimple or whatever, or maybe she can go for treatment if there's offensive discharge coming out at that level, but at most times she won't even know it. Now this infection then grows into the reproductive system, climbing up the vagina into the cervix, causing what we call cervicitis, inflammation of the cervix. It climbs to the endometrium, which is the lining of the womb, which is what we call endometritis. And then it can reach the fallopian tubes, where the fallopian tubes again are damaged, the blood supply is affected, the cilia get damaged, and the fallopian tube is supposed to be open like this. The canal should be open like this. Now you can get scar tissue forming in the tube, which then ends up blocking the tubes from the scar tissue. Because you know, our skin or our bodies, when we heal with scarring. You know, if you see a scar, you know there was damage there. So it's the same with the fallopian tube. And the fallopian tube is so fragile, it's so flimsy, you know. It's such a thin, fragile organ that scarring in it actually just straight away causes a blockage and then does not allow the egg and the sperm to meet. So things like chlamydia and gonorrhea and even pelvic TB can cause destruction of the fallopian tube. There are other conditions as well, unfortunately, like endometriosis, where the lining of the womb or the contents of the lining of the womb is found outside the womb, and they can be found at the level of the fallopian tube or the ovary, or the inflammation around the pelvis can cause the distortion of the anatomy of the tube. Instead of it flowing nicely to the ovary, it gets bent, it gets hooked, it gets attached to the back of the uterus or attached to the bowel, and that causes a physical obstruction that then blocks the tubes. So that's how we get that. Those are a few of the many different ways that the fallopian tubes can actually be damaged.
Okay. And then can I still conceive with one fallopian tube?
Now, the big answer to that is drum roll. Well, it depends. The answer is it depends. And really, it depends on the condition of that remaining fallopian tube. There are many women who've had one ectopic pregnancy and only one tube was affected. We thank God. I have a lady that I was talking to just last week, and she was coming for her 6-week follow-up. And the first time I met her, she had an ectopic pregnancy. And this is about 3 years ago. And I went in, and unfortunately the tube was damaged. It was already a ruptured ectopic, and we had to remove her tube. And then after removing the tube, we had to test the remaining tube, the contralateral tube. When we tested the fallopian tube, we found that that tube was actually patent, it was open. The fact that the tube is open, though, does not automatically guarantee that the tube is functional. Remember, the cilia are microscopic. We can't see them with our natural eye. We don't know if they're working or not. So it will be a matter of trying. So this lady, as we speak, she was here after the delivery of her second baby. after that ectopic pregnancy that happened about 3 years ago, and she is falling pregnant with just one fallopian tube. So if you have a very good fallopian tube, yes, you can still fall pregnant with it, but understand that the chances of falling pregnant are then halved, because if you were sitting at 100% with both tubes, then now one tube is missing, so you're sitting at a 50% success rate. Now, again, the chances of falling pregnant will also depend on other things like the quality of your eggs, the quality of the sperm, and the functionality of the tube that is remaining. If that one fallopian tube is fully functional and you time accordingly, there are some patients that we do intrauterine insemination for, where we push the sperm in, but and we need to wait for the egg to be growing on the side of the functional tube, because if we have an egg that is on the side of the tube that's removed, you know, that won't help us in any way. So we have to wait for the right side and the right time and do the right thing. It does take time. So for some patients, they just feel, look, it's too cumbersome. Rather, we just do something that is a step ahead, that has more chances of success.
Okay. And then, am I at risk of having another ectopic pregnancy after I've had one?
Yes, the answer is yes, unfortunately. And this is because, you know, the entry to the womb is one, and the fallopian tubes are at one level. So it's like opposite neighbors. Whatever goes in is most likely to go to the left and to the right. So if the left fallopian tube is affected, most times the right fallopian tube will most likely be affected. And again, it depends on how this fallopian tube that was affected was treated. Sometimes we don't take out the whole fallopian tube. We take out the whole fallopian tube to reduce the risk of a further ectopic. But sometimes, as I said, if it's at the fimbria, we just milk it out. Sometimes we give you medical treatment if you fulfill the criteria. There is a proper criteria that you need to fulfill for us to say, we're not going to surgically treat you, we'll medically treat you for this ectopic. Sometimes we just make a hole at the level of where the ectopic is, and then we close it up and suture, but that's already a scar. And then remember, scar tissue can lead to blockage or stenosis. So that's why there are risks of actually having another ectopic pregnancy if you've previously been treated for a previous ectopic, or the other tube is already affected. So when we go to treat, surgically manage a patient with an ectopic pregnancy, we tell them before theater, before we knock them out, we say, whilst you're still sober and you're in your senses, let me warn you, there are chances that both tubes can be affected. We may find that whatever inflammation and swelling is on the side of the ectopic may be on the other contralateral side as well. And you may, if we find that the tube is swollen and it has fluid, which is what we call hydrosalpinx, we may need to remove that tube before you get an ectopic pregnancy to reduce your chances. Meaning if we remove both tubes, then your only chances of falling pregnant are through in vitro fertilization. We warn you in advance. And then there are some women who say, yes, I will take that. I will rather go to theater once, remove everything that is putting my life in danger, and I will go straight for IVF. And there are others who say, look, go and sort out the current problem. We'll see the other things later. Don't be limiting my options. And, you know, your wish is our command. That's why we discuss, and then we get proper management. It is our duty to advise according to our knowledge and our experience, and then we make what we call a combined decision.
Okay, and then the last two questions, I've got 2-3 minutes left. Are there any symptoms to look out for when it comes to ectopic pregnancy?
Yes, number one is missing your period. If you see that you have not gone to your normal menstruation, there are chances that you may be pregnant. Now, if you miss your period and you start spotting and you're not getting a normal period, and now you start getting pain, and the pain in the pelvis is most times situated to either the left or the right at most times, so showing that it's either a left or a right ectopic tube, ectopic pregnancy. And then when you start bleeding heavily and you bleed with pain after missing a period, some women wait until they feel dizzy and lightheaded, and that's a bit too late. So those symptoms of missing your period, starting to bleed and having pain are the trio that says, please get yourself checked out. Because if you are just having a normal period, you shouldn't be in severe pain.
Yeah. Our last question, Dr. Q, is, do you have any advice, words of advice to our ladies trying to conceive or currently trying to conceive?
Yes. So ladies, just be aware that it takes more than 75% of the population, like 80% of the population, to fall pregnant without any problems. It takes about 12 months. So if you've just started to try to conceive, please don't put pressure on yourself. Enjoy your intimacy with your partner. And then 2, when you're trying to conceive, just keep a calendar. Know when you're starting to menstruate. The first day of your period is day 1. Know what your cycle is like. Know when you're ovulating. If you're timing, start with the simple steps. If you're timing, just get an ovulation kit at any pharmacy. See if your body is really ovulating. If you're more than 35 and you are not succeeding with knowing your period, knowing your cycle and all of that, please don't delay. Come and see a fertility specialist. Especially for those more than 35, I would recommend they go straight to a fertility specialist. But if you are less than 35, then you can go ahead.
Oh, Doc, you're going off. Is that your phone?
You're trying to conceive, get yourself checked out, and please go with your partner, because we find a lot of diagnosis actually that is associated with men that also need to be treated. So before going for major surgery thinking the problem is only with you, it takes 2 to tango. So let us both go together to be checked out, so that again, I don't have to get home and explain everything to my partner, all this jargon that Dr. Diale has been speaking about that I hardly understood. Now I have to play broken lines, broken telephone. So please do come with your partners for checkup, and we are more than willing to help.
Awesome. Thank you, doctor. So I just want to say, there's so many questions that's coming through for you, but what I'm going to do, guys, is I'm going to ask Kim, she's the lady that's helping me today, to just put your Dr. Diale's details in the comment section. I know she did it earlier. So if anyone's got any questions, would like to make an appointment to come and see Dr. Q, please contact her. And we'll put the details in the comment section there. Thank you, doctor, for always being willing to do these talks with us. You're amazing. We love you, and thank you for everything that you do for the women when it comes to infertility and fertility treatments. Thanks, Dr. Q.
Thank you so much. All the best to everybody.
Thank you. Bye.
Bye.
So, guys, bye-bye. We have our next winner of the SOFIT giveaway. It's at the Advanced Fertility Shake. And her name is Kio M. So Kio M, please contact us. Kio M, you have won Advanced Fertility Shake, compliments of SOFIT. And please DM me, and we can then arrange to get this to you. So Kio M, the winner of the SOFIT giveaway. Thanks, guys, and we'll see you back on Instagram in the next 5 minutes. Thanks. Bye.